Hello, and welcome to our presentation on senior dental care. We are your hosts. I'm Madolyn.
I'm Sara.
And I'm Lindsay.
Today we will be going over some very important topics on oral health. To help introduce this presentation, here's a short video.
Sure, I've been around the block a few times, so this idea about being mouth healthy for life is nothing new for me. These are the originals, and I plan on keeping them that way, so you don't have to teach this old dog any new tricks. Yes, I brush every day, twice a day, thank you, and floss to clean between my teeth every day. And I see my dentist regularly. Smart, healthy stuff you should be doing all your life. But more important now than ever, because folks our age have a few more challenges. Like the medications you're taking now can have an effect on your oral health. Make sure you keep your dentist up to date on exactly what you're taking. And if you're like me, well, arthritis can be a bother when you're trying to brush. A larger handle can be of help, or a battery-operated or electric-powered toothbrush might make it easier for you. Okay. Maybe now there are some new tricks we can learn, huh?
Today we will discuss the importance of oral health, common dental problems, the effects of dry mouth and how to manage oral side effects of medications, how to control plaque bacteria and protect the mouth from harmful bacteria, brushing and flossing techniques and strategies, and finally, how to obtain the ability to recognize and manage dental problems and early signs of oral cancer.
Taking good care of your mouth, teeth, and gums is very important for overall health. Good oral and dental hygiene can help prevent bad breath, tooth decay, gum disease, and tooth loss. The most common dental problems seen in senior citizens include gum disease, periodontal disease, cavities, mouth sores, ill-fitting dentures, and xerostomia, which is just a fancy word for dry mouth. Now let's talk a little bit more about xerostomia, or dry mouth, because many of you have experienced this. It's important to note that dry mouth is not a normal part of aging. There are many common medications that can reduce the production of saliva. Xerostomia can cause the following: increased risk of cavities, gum diseases and infection, difficulty eating, swallowing, or even speaking, changes in taste, and it can also contribute to ill-fitting dentures. Some people can benefit from sucking on sugarless hard candy or by using an artificial saliva substitute.
Dental diseases are preventable with daily plaque control. So what is plaque? Is it similar to arterial plaque? No. Plaque is the most common and serious dental health issue. Plaque starts as a soft and sticky film of bacteria from foods and sweets that forms on teeth and dentures. This hardened plaque is called calculus, similar to the math term. It is more commonly known as tartar. This holds bacteria in the mouth and causes damage to the gums and the bone that supports teeth. Aging does not cause tooth loss. Plaque causes tooth loss.
Okay, as Madolyn said, dental plaque is one of our major issues. There are many devices out in the market today that can remove this plaque from your teeth and your gums. I'll first start off by talking about the electric or powered toothbrush compared to the manual toothbrush. When looking at the manual toothbrush, you can see that it consists of a head of bristles and it's attached to a handle. When choosing your manual toothbrush, you always want to make sure that you choose a head that is soft. They are also available in medium and hard bristled heads. However, these can do damage to your teeth, and if you brush vigorously, this can wear away at your gums. This is the powered or the electric toothbrush. It is battery operated. This has a larger handle, as you can see. than the manual toothbrush. So if you have dexterity issues, this is an excellent choice. This allows for better grip. Also, because it's battery operated, this does the work for you. So this head will move in a rotational motion or a back and forth motion. Also, when you put too much pressure on your teeth with the actual bristles, this will light up. So this is also another feature that is excellent to make sure that you're not putting too much pressure on your teeth and your gums when brushing. When looking at brushing the actual teeth with both, it's actually pretty similar. With the manual toothbrush, you want to make sure that you're not only putting the bristles on the tooth surface, but you want to angle it 45 degrees up into the gum line. This allows for the debris to be released. You want to move in a circular motion, about 5 circles each tooth, moving forward until the entire arch is complete. Once the outer surfaces are finished, you want to make sure you go into the inner surfaces of the teeth, put the brush on the inner surface, angle it up towards the gum line, and go ahead with those circular motions until the entire arch is complete. Finishing up with the bite surfaces, releasing that debris from those pits and grooves. As for the power toothbrush, you want to do the same thing. However, this brush does the work for you. So once you place the brush on the tooth surface, angle it up again towards the gum line, turn your brush on, it'll start spinning or moving in that back and forth motion, and you just go ahead and move the brush a couple seconds each tooth, moving forward until the arch is complete. Same thing, you want to make sure you get the inner portions as well as those biting surfaces. And as always, you want to make sure you're brushing twice a day, both morning and at night. This is very important. Also, you want to make sure when brushing that you're brushing for at least 2 minutes. And when your toothbrush, and when you see the bristles getting low or a little frayed, you want to make sure you're changing that toothbrush head to your power toothbrush or changing your actual manual toothbrush. Or you can just simply change them every 3 months. All right, now that we talked about the devices that remove plaque from tooth surfaces and gum lines, let's talk about those that remove plaque from in between your teeth. There are many things out there on the market today. There's string floss, there's floss picks, there are Proxa brushes, as well as access flossers. So the string floss is one of the most common. However, some people still have difficulty manipulating the string. So then we go ahead and recommend a dental floss pick. However, the picks sometimes aren't the best because they can't really curve around that tooth. And they're still hard to reach areas that we can't get to. In those instances, we would recommend an access flosser. So this is a device that has a handle, grip, and then it has a flosser on the end. So this allows us to hold it outside of the mouth, still reaching those hard to reach areas in the back there and getting in between those teeth. The last one I'm going to talk about is the Proxa brush. This is great if you have spaces in between your teeth. So with that, you take the brush and you go ahead and place it in between those spaces in the teeth, allowing for it to remove the plaque from in between. Dentures. So what about dentures? It's very important that you clean your dentures at least once a day because dentures too can accumulate plaque. There are many items out in the market to help with this cleaning. There are tablets you can soak your denture in nightly, as well as dental paste that you can use along with the dental brush to brush your denture. Also, don't forget that storage case. Make sure you rinse this thoroughly before your first use, and you also want to make sure you're cleaning this weekly. Now let's check out a video to show you how to clean them.
In this video, we'll show you how to clean and care for a denture. There are different types of dentures: metal, plastic, some that replace all teeth, and others that replace one or a few teeth. Dentures should be regularly removed and rinsed to remove food debris and cleaned thoroughly at least once during the day to help prevent fungal infections. The denture should be safely removed either by the wearer of the denture or a carer and placed in a bowl or denture container. For a patient who needs help removing a denture, wash hands and put on gloves. For an upper denture, slip finger by side of denture to break the seal and lift the denture out of the mouth. Do the same for a lower denture. If there are clasps on a denture, push them up for a lower denture and down for an upper denture. Partial dentures can sometimes be tricky to remove. Fill a bowl or sink with water. The denture should be brushed over a bowl to prevent breakage with a denture brush or toothbrush for natural teeth. The denture should be brushed using liquid soap or denture cleaning paste. Toothpaste can cause damage to the surface of a denture over time. All the surfaces need to be brushed. Next, thoroughly rinse with water to remove the debris and soap. If a fixative is required, the denture should be dried using a paper towel and a small amount of fixative applied to the contact area of the denture, and then the denture fitted back into the mouth. When not being worn, the denture should be stored in a named denture pot with fresh, clean, cold water. It's important to clean the mouth and tongue when the denture has been removed, even if they have no teeth. Ideally, denture should not be worn overnight to let the lining of the mouth recover from wearing dentures during the day.
Now that we've talked about proper oral health and hygiene, let's talk about problems to report to your dental professional in between your routine cleaning appointments. These can include loose or broken teeth, brown areas or dark staining, bleeding gums, or ill-fitting dentures. There are some changes that can be early signs of oral cancer, and it's important to note these even if you don't experience pain. These signs and symptoms can be swelling, numbness or tingling, sores, red or white patches throughout the mouth or on the tongue. Lastly, let's go over and review our learning objectives. You should now be able to discuss the importance of oral health, discuss common dental problems seen in senior citizens, discuss the effects of dry mouth and how to manage oral side effects due to medications, discuss how the control of plaque bacteria can protect the mouth and body, discuss the importance of proper denture care and brushing and flossing techniques, and obtain the ability to recognize and manage dental problems and early signs of oral cancer. On behalf of Madolyn and Lindsay, we want to thank you, and we hope you enjoyed our presentation.